Hello class, today I will be presenting kyphoscoliosis. My goal is for all of you to have a clear understanding of this disease. Hopefully, by the end of this presentation, you will all remember important key points regarding about kyphoscoliosis. I have also added questions from the kyphoscoliosis trivia worksheet to help refresh your mind for the final exam. So then, let's get started. We will begin with the definition of kyphoscoliosis. So what is kyphoscoliosis? It is a deformity of the spine characterized by abnormal curvature of the vertebral column in two planes. The first plane is coronal and the second plane is sagittal. It is also a combination of two thoracic deformities that commonly appear together. So what does all of this exactly mean? Well, kyphoscoliosis is a combination of two thoracic deformities. The first thoracic deformity is called kyphosis. Kyphosis is a posterior curvature of the spine, also known as humpback. In this picture, it compares a normal spine to a kyphotic spine, where you can easily distinguish the abnormality of the spine because it shows a humpback, or another word for it, hunchback. As you can see, it is also in a slouch position. The second thoracic deformity is called scoliosis. Scoliosis is defined as the spine being curved to one side, and it appears in either an S or C shape. In this picture, it also compares a normal spine to a scoliosis spine. It has an appearance of an S or C shape. You can also easily tell the difference when the scoliosis by looking at the shoulders and waist. The shoulders are both uneven, such as one shoulder blade appears more prominent than the other, and the waist is also uneven because one hip is higher than the other. Question number 1. Posterior and lateral curvature of the spine is best described as A. Kyphosis, B. Scoliosis, or C. Kyphoscoliosis. If you guess C, you are correct. Another easy way to remember is by breaking down the word. So, kypho is a posterior curvature and scoliosis is a lateral curvature. Putting both words together, you get kyphoscoliosis, meaning the posterior and lateral curvature of the spine. Moving on to alteration of the lungs pathophysiology, kyphoscoliosis is a restrictive lung disease. It is considered to be one of the most severe restrictive disease of all chest wall diseases. The vital capacity is decreased due to inspiratory muscle weakness. The total lung capacity and functional residual capacity are both decreased due to decreased lung compliance because the chest wall is impaired, which prevents normal inflation of the lungs. There is decreased lung compliance due to decreased chest wall compliance, and breathing is at low lung volumes, which tend to get worse with aging, degree of spinal curvature, and other unknown structural changes. There is also compression of the lungs because the thoracic deformity. The mediastinal will shift to the curvature side. For example, if the curvature was on the left side, then the mediastinal will shift to the left. There is also mucus accumulation throughout the tracheobronchial tree, which makes mobilization of secretions difficult. Atelectasis is also present, where areas of the lungs are compressed. Respiratory failure is a common morbidity and mortality in patients with kyphoscoliosis. Question number 2. Patients with lateral and posterior curvature of the spine would tend to A. Have small lung volumes in all age groups, B. Have normal lung volumes if they are young, C. Have smaller than normal lung volumes if they are older, or D. Have larger than normal lung volumes if they are older. If you guess A, you are correct. To question number 3, your patient has curvature of her spine to the right side. How will this affect the position of the mediastinal contents? A. Shift to the left, B, shift to the right, or C, there is no effect, it will not shift? The answer is B. Remember that the mediastinal will shift to whichever the curvature side is located. Kyphoscoliosis etiology and epidemiology affects approximately 2% of people in the U.S., and it can manifest at different stages and occur at a young age ranging from childhood to teenage years. It can also be present from birth. Kyphoscoliosis mostly occurs in young children who are going through a growing spurt, and it rarely develops in adults unless the condition started in childhood and was not diagnosed nor treated. And if it does develop in adults, it is from a degenerative joint condition in the spine, and this usually occurs in patients who are 50 and older. Furthermore, there are also many idiopathic occurrences of kyphoscoliosis where the exact cause is unknown, but it is suspected to be caused by genetic factors. Question number 4. Which age group is most likely to develop kyphoscoliosis? A. Adults, B. Young children, or C. Newborn babies? If you guessed B, you are correct. What are some other possible causes of kyphoscoliosis? Hormonal imbalances such as stress, trauma, extraspinal contractures, infections involving the vertebrae such as osteomyelitis caused by a bacterial or fungal organism after a spinal surgery, metabolic bone disorders such as rickets or osteoporosis, joint diseases, and tumors. Kyphoscoliosis is commonly associated with the following conditions: neuromuscular scoliosis caused by poor muscle control, muscle weakness, or paralysis because of diseases such as cerebral palsy, muscular dystrophy, spina bifida, or poliomyelitis. Idiopathic scoliosis from an unknown cause. It is the most common cause of kyphoscoliosis of about 80 to 85% of the cases that appears in a previously straight spine. And I also want to mention that for neuromuscular scoliosis, progression of the curve occurs more frequently than in idiopathic scoliosis. The progression most likely often continues into adulthood, and the long-term effects of the spine deformity can make the person disabled, such as losing the ability to sit. For example, in this picture, when the deformity is severe like in the picture, surgery and stabilization are both needed. As for congenital scoliosis, it is a malformation of the spine column, the vertebrae fuse together, or the bones do not form properly. Surgical treatment may be needed at a very young age, and if it is untreated, it may eventually lead to paralysis of the lower body. Question number 5. The most common cause of kyphoscoliosis is A. neuromuscular scoliosis, B. congenital scoliosis, or C. idiopathic scoliosis? The answer is C. Remember that idiopathic scoliosis means an unknown cause? Well, I found out that for infantile scoliosis, there are actually two interesting theories why scoliosis occurs in infants. The first theory is called the intrauterine molding, suggests that the spine is bent at the time of birth and worsens with growth. The second theory is called the post-delivery, that placing the infant on their back will lead to flattening of the skull and scoliosis. Aside from the two theories, let's move on to when it develops. Infantile scoliosis, the curvature of the spine develops during the first 3 years of life. Juvenile scoliosis, curvature occurs at 4 years of age to the onset of adolescence. And adolescent scoliosis, spinal curvature develops after the age of 10, and it is also the most common type of scoliosis. Pertinent findings during assessment. Laboratory findings: severe and or late stage kyphoscoliosis, increased hematocrit and hemoglobin, hypochloremia, hypernatremia. Physical findings: you will find increased heart rate, respiratory rate, blood pressure, cyanosis, digital clubbing, peripheral edema and venous distension, as well as cough and sputum production. And I also want to add that with severe kyphoscoliosis, signs of the right heart failure can be present along with these symptoms such as cyanosis, distended neck veins, peripheral edema, and hepatomegaly. Patients with severe deformity is generally present with dyspnea, hypoxia, hypercapnia, and in development of pulmonary hypertension, along with associated with polycythemia that is secondary to hypoxemia. Continuing on to radiologic findings, you will find thoracic deformity, mediastinal shift, increased lung opacity, atelectasis, enlarged heart, and in chest assessment findings, you also find thoracic deformity, tracheal shift, increased tactile and vocal fremitus, dual percussion note, bronchial breath sounds, whispered pectoriliquy, crackles, bronchi, and wheezing. Question number 6. Which of the following are associated with kyphoscoliosis? A. Diminished breath sounds. B. Dual percussion note. C. Dual percussion note and bronchial breath sounds. Or D. Diminished breath sounds and decreased tactile fremitus. If you answered C, you are correct. Diagnosis. This disease is diagnosed by physical examination, medical history, X-ray evaluation, and curve measurement. Angle of the curvature. It is the measure of the curvature of the spine in degrees, which helps the doctor to determine what type of treatment is necessary. So greater the curvature, the curve progression will worsen. Location. The curve of the spine may develop in the upper back area or lower back area, or possibly in both areas. Angle. The degree of the lateral curvature is expressed by the Cobb angle. Direction. It can bend to the left or right. Shape. Non-structural scoliosis is a curve that develops side to side, such as a C or S-shaped curve. Structural scoliosis is a curvature of the spine associated with vertebral rotation, meaning it involves a twisting of the spine and appears in 3 dimensions. Like in this picture, you can see the rotation of the spine. Treatment and floor therapy. The treatment depends on the cause of scoliosis as well as the location, size, curve, and growth spurt of the patient. Spine curvature less than 20 degrees is considered to be small, and it only requires observation to ensure that the curve does not progress. Young children who are still growing require observation checkups that are scheduled in 3 to 6 month intervals, and observation is usually the first method of treatment for a young child in the U.S. Almost 90% of infantile curves resolve spontaneously on their own, and spine curvature of 25 to 30 degrees is considered to be more serious. Question number 7. A child is found to have a spinal curvature of about 10 degrees. The physician is most likely to recommend A. Surgery, B. Brace, or C. Observation. The answer is C. Remember that 10 degrees is considered to be mild, so only observation is needed to monitor the curve progression. 25 to 30 degrees curvature treatment options. The first line of treatment is a brace device. The objective of using a brace is to restrict the forward bending of the spine. It is not meant to cure the disease. It is used to limit or prevent the curve from progressing. This is called the Boston brace, also known as a low-profile underarm or thoracolumbrosacral brace, composed of plastic that is custom molded to fit the patient's body, and it is typically used for curves in the lumbar, lower back, or or thoracolumbar, and it is worn for about 23 hours a day. Now, this brace can be taken off to shower, swim, play sports, or other daily activities as well. This is called a Charleston brace. It is also known as a part-time brace. It is worn for only 8 to 10 hours at night when the human growth hormone level is at its highest, and it works to overcorrect the curve while the patient is asleep, and the patient's curve must be 20 to 40 degree range for the brace to be effective. And the principle of this brace is that the spine should be bent to grow in the correct direction during the time of the day that the most growing occurs. The third type of brace is called Milwaukee brace, also known as cervical thoracolambosacral orthosis, used for high thoracic mid-back curve. As you can see, it is also a full dorsal brace with neck rings that serve as a rest for the chin and for the back of the head. And this type of brace has metal bars that extends the length of the torso and neck rings to keep the head centered over the pelvis. This brace is used less frequently now because there are more form-fitting braces that are available to patients that provides more comforting measures. Also, more treatment options such as surgery. Surgery is recommended for curvatures of the spine greater than 40 to 50 degrees. And I also want to add that surgery does not completely straighten the spine. And then spinal fusion involves placing pieces of bones between two or more vertebrae. Now, they take the bone sections from the pelvis or the rib to do the spinal fusion. And the rod instrumentation, the insertion of metal rods, hooks, screws, and wires to prevent the curve from moving for 3 to 12 months. And this allows the spinal fusion to solidify. So at what point should someone with kyphoscoliosis go to the ICU? Well, middle-aged patients with 200 degrees will tend to develop dyspnea and have repeated acute respiratory infections. Curves above 100 degrees are rare, but they can be life-threatening if the spine twists the body to the point where the heart and lungs do not function properly, and at risk for respiratory failure. Now, we know that kyphoscoliosis is characterized by diminished chest wall compliance and impaired respiratory functions that is progressive to hypoventilation, hypercapnia, and chronic respiratory failure. Acute exacerbations can occur as well, particularly with respiratory tract infections that can rapidly worsen the patient's conditions and followed by acute respiratory failure, which ICU hospitalization is needed for an invasive mechanical ventilation. So what is the role of an RT? Well, let's begin with oxygen therapy protocol. Oxygen therapy is used to treat hypoxemia that is commonly caused by atelectasis and pulmonary shunting. It is also used to decrease work of breathing and myocardial work. Second, bronchopulmonary hygiene therapy protocol. And there are a number of ways to mobilize secretion, such as CPT, PEP, such as flutter, acapella, chest percussion, and suctioning. And third, lung expansion therapy protocol, and this is used when to counteract atelectasis, such as IPPB. Question number 8. A patient with kyphoscoliosis will often require all of the following respiratory care except A. Oxygen therapy protocol, B. Mechanical ventilation protocol, C. Lung expansion therapy protocol, or D. Bronchopulmonary hygiene therapy protocol. If you guessed B, you are correct. Prognosis depends on the type, cause, and severity of the curve. The more severe it is, the most likely that it will get worse. People with mild to moderate scoliosis, It is not too serious. Some will do well with braces and others just require monitoring. They usually do not have long-term problems, but back pain can most likely occur when the person gets older. When it is severe, it can cause dangerous changes to the heart and lungs, which increases mortality rate. And cor pulmonale can occur as well. It can develop with severe curvature, and the prognosis is poor without treatment, which death generally occurs within a year. And I also want to add that it can also poorly affect the individual's self-esteem and can cause serious emotional problems as well. Prevention. There is little that can be done to prevent kyphoscoliosis, although early diagnosis and intervention are beneficial. There is physical therapy that provides flexibility, stronger muscles, and pain relief, but it cannot prevent or correct the curvature of the spine nor the progression. Exercise is important for general health and strength, but it doesn't prevent or slow the development, it just helps to maintain range of motion. Good nutrition is also important for the general health, but there's no specific dietary foods that has been shown to control the progression